we're here today talking about big data and AI, the promise, the perils of big data. And I think, particularly for me, coming from a public health background, I think of big data and AI as a way to be able to improve the health of entire populations as opposed to, sort of one-on-one individual care. And so, on the panel today, we have medical doctors, we have PhDs, we have a whole variety of doctors here. And so I'm particularly interested in exploring this intersection between, one-on-one individual care, but then also thinking about the broader population and how we actually improve health. So I'm delighted to be here with Geoff and Corey. I'll say a few words just on their backgrounds, and then we'll dive into big data and AI, which for many is a little bit of a nebulous concept, but I think, and I'm hoping that with this panel, we'll really be able to dive into what it means for healthcare. How do we think about big data, AI, and what are some concrete examples of different groups working on different projects in the area. So I'll do just a brief overview. I'll start with Dr. Geoff Rutledge. He's the co-founder and chief medical officer at HealthTap, and he's been very involved with building Dr. AI, which is HealthTap's network of about 100,000 doctors all across the U.S. Working to build out that network and the AI platform there. He's a double board certified physician. He also has a PhD in medical computer science from Stanford, and he's held a whole variety of very senior leadership positions at Healthion WebMD, First Consulting Group, San Mateo Medical Center, and Hippocrates. And we just heard from Tom Lee previously, who obviously knows Hippocrates very, very well. We also have Corinna Lathan here, Dr. Corinna Lathan, and she is the co-founder and CEO of AnthroTronix, which is a biomedical engineering R&D firm focused really on building digital health products, wearables, robotics, augmented technology products. And most recently, she's been involved in developing Dana, which is an FDA-approved mobile digital health software platform, working very closely with the Department of Defense. She's, which I think is super cool, a judge and advisor to the X Prize, and her background is in aeronautics, astronautics, and neuroscience. So I'm delighted to have both of you here today, and when Joe arrives, I'll certainly introduce him as well. But Geoff, maybe I can start with you, and I'd really like to ground this conversation in, when you think of big data and AI and healthcare, so often these words are just thrown around very, very easily. Can you give me a sense, and can you give me and give the audience a sense in terms of, what do we actually mean when we talk about AI, big data, and what does that mean in the healthcare context?
That's a wonderful question, Gillian. Thanks again for having me participate on the panel today. Can you guys hear me okay? It's interesting to think about medicine has really been a very fertile ground for the development of AI. The history of the origins of AI date back to the early 60s and 70s, and we've seen development of knowledge-based or model-based AI as sort of the foundation. And many of the applications that are out there today, certainly almost all of the symptom checkers, for example, are built on this idea of building systems from the knowledge. What's been missing, of course, is the ability to have these models as driven by data. If you think about until recently, the process of healthcare was not fundamentally digital, and the determination of how care was delivered was not being measured or recorded in any kind of systematic way. Because to your point about big data, if you want to build machine learning models built on data, if you want to have a data-driven approach to deciding how to participate or improve the healthcare process, you really need massive amounts of data. And so it's really been the advent of digital health platforms and the electronic medical records, which have for the first time created stores of information from which it's possible to build data. So we think about the excitement about AI, we realize we've demonstrated some really incredible possibilities when you have large amounts of data.
Yeah, every time I try to click the blue, oh, actually, it looks like I'm
Joseph,
on now.
now you're in. Joe,
Hello,
we're hearing you.
Good afternoon, and thank you for joining us as well. And apologies about the tech difficulties.
Oh.
Geoff, if you don't mind, would you mind if I just introduce
Please.
Joe and then
Why don't you go ahead since Joe's with us now?
So also now that Joe is with us, I'm very, very delighted and excited to introduce Dr. Joe Rutledge. He's a board certified endocrinologist. He is a retired Army colonel where he served for more than 30 years. And he's been the chief medical officer for Virtual Health out in Fort Gordon, Georgia, with the Dwight D. Eisenhower Army Medical Center. So we're very, very delighted to have him. And I should also note that he and Dr. Rutledge have focused an upcoming book chapter on AI in healthcare as well. So long-standing collaboration between both Dr. Rutledge and him. So delighted to have you here, Joe, and apologies again about the tech difficulties.
We're good now.
Thanks for having me. I think I'm okay.
Okay, wonderful.
We can hear you.
So
Dr.
perhaps
Rutledge,
I should just finish that thought, which was to say we're now on the cusp with the advent of access to clinical information. We're at the cusp of being able to build models that allow us to support and improve what doctors do. I should mention that the incredible excitement about AI in healthcare has largely been restricted to domains where there's lots of data. So you see, for example, radiographs, which have been labeled by radiologists, allow training sets and models that lead to the ability to understand or interpret what images mean. You see the same thing happening in dermatology with skin images. You see the same thing happening in retinal scans, and ophthalmologists able to screen and review data because the data exists. What we're looking for now, and really on the cusp of being able to use those data to inform and improve the way we make clinical diagnostic models. Because for the first time, we have access to large amounts of coded data about patients, and the ability to use data-driven models to support what have previously been really only knowledge-driven models is what we are on the face of, or we're on the brink of being able to do right now. We're very excited to do that. I wanted to mention one of the exciting things about this work is the realization that AI can improve processes of healthcare by informing and assisting doctors in doing their jobs. Recently just actually published a paper in which we studied what impact it had on doctors' diagnostic ability when you actually showed doctors the results of an AI-driven diagnosis. One of the things some people have noticed that there were publications measuring the accuracy of these online AI diagnostic systems, and frankly, they don't compare to the accuracy of doctors looking at the same data. What this study showed was that even when you had an AI diagnosis that wasn't perfect, because you had a long list of diagnoses and it didn't pick the right one on the first spot. What we demonstrated was that when you showed a list of AI-generated diagnoses to doctors, their diagnostic performance improved. And not by a little bit, by a lot. In this study, the diagnostic performance unaided, where the doctors were shown cases and asked to say what's the most likely explanation, they got it right about 55% of the time. Remember, this is just the symptoms without the examination and without the laboratory findings. So they didn't have the ability to interact with the patient and carry through to find out where it really was, but rather that initial assessment based on just the symptoms. And they got it right 55% of the time. When we showed them the list of possible diagnoses generated by AI, the correct answer rate went up to 80%. So doctors' diagnostic accuracy improved dramatically when shown a list, even though the AI didn't know for sure which one it was. The combination of AI with the doctors led to a substantially improved performance for doctors. This gives me great hope that the application or the integration of AI support and a medical decision support capacity will have a substantial improvement on doctors' performance. And this is only possible in the world of digital health, where the care is being delivered in an online or mobile fashion, where people are interacting with intelligent agents able to do an interview through the AI-based interaction as a first step. And this suggests that the automated interaction with a medical interview with patients not only improves the speed and efficiency for the doctor taking care, but by providing a list of possible explanations to the doctor can actually also improve the doctor's performance.
Yeah, no, it's fascinating to understand all of that, Dr. Rutledge as well. And, you know, Joe, I know you've been very involved in this big data and AI ecosystem as well. And, you know, you've very much been involved in sort of, you know, thinking about how do you take virtual health and virtual care with big data and AI and do this, you know, from different countries, different locations. And so I was wondering, you know, from your perspective and perch as an endocrinologist, are you able to give us in terms of, you know, how have you thought about big data and AI, you know, within your practice, but then also what are some of the challenges that you've encountered in doing so as well?
Sure. Thank you. Great to be here, everybody. I'm sorry for all the technical challenges. Can you hear me okay?
We can hear you well.
All right, great. Well, I've been doing virtual health for about 6 years personally as a clinician, and also developing virtual health department of the Army for the last few years. And one of the unique aspects of the military healthcare system is that my medical license is portable. I can see patients anywhere around the globe that are military beneficiaries. That's one big advantage. The other is that we have a global EMR system. It's the same platform wherever you are within the military health system. So that affords me access to data and information that truly have a global clinical practice virtually. So I also do remote home monitoring, clinic consultations, asynchronous consultations, directs to patients' homes or in Afghanistan or Iraq or in Korea. So I've been able to follow my patients around they move, which has been a very unique and satisfying clinical practice. The big challenges that clinicians have outside of a system is access to the data. And that's a big challenge because data is not shared across healthcare systems. And even within the military health system, I would say lack of integration of all the IT systems is a big barrier. As a clinician, I have to log into multiple systems to get access to some of the data. The same goes on the patient side. So the access to data is one of the big challenges. Government healthcare system like the military or outside. But I see a lot of very low-level AI solutions for the challenges that we suffer as clinicians with data input. You know, just simplify things like voice to text, collect information during an interview, automatically populates my record. That would save a lot of time. Clinicians spend much of their time creating notes and looking at the EMR on the patient. So I see a lot of very low-level AI solutions that I haven't seen market yet that would really help us as clinicians. Documentation support on all kinds of levels, sending the patient a survey instrument before the appointment that could then automatically populate my review of systems, for example, in HPI, would be very beneficial. And what Geoff was speaking to, clinical decision support, that would be very valuable in all kinds of specialties. And then the population health management. So in the background, you know, the AI would be looking at my patient population and seeing who needs labs, who needs a follow-up so that I don't have to remember that or the patient doesn't have to remember that. So a lot of very low-level things, I think, that would greatly enhance my ability. Because if you think about virtual health encounters, they're still one patient, one doc. It's really not much more efficient than face-to-face. It does eliminate the geographic barrier, and it can eliminate the time barrier if it's asynchronous consultation. Still, it's not as efficient as it could be. So I see the promise of AI as really freeing me up to do those things I uniquely do as a human, and that's to show empathy and compassion instead of being a data and trying to pull all the information from all these disparate sources.
Yeah, no, I think that's completely spot on. I mean, I think there's so many ways that
Were you able to get any of that?
Yes, no, we heard you. That was fantastic. No, I think I was just responding saying that that's certainly so much of these AI technology can be used to help us support the clinician, which at the end of the day should ultimately lead to better health outcomes for the patient. So I think that's, yes, on the one hand, it's helping to support the clinician, but on the other hand, is actually helping the patient at the end of the day. So that for me, I think is very, very, very exciting. Corey, turning to you, and I realize you come at this from perhaps a slightly different angle, thinking more about the brain and cognitive.
Those tools, if it may be more efficient, that improves access to care. That's how. That's one of the ways.
No, I think that's completely spot on. Corey, to turn to you a little bit. I know that you come at this from. No, you're good. You're good, Joe. Corey, I think you come at this from a slightly different angle, which is thinking about the brain, cognition, the cognitive sciences. Can you give us a sense in terms of when you think about AI and big data and its application to that space? Can you talk a little bit about the opportunities that you see there for using, I suppose, AI and big data in that area?
Yeah, sure. There seems to be quite a bit of feedback, though. I don't know if that's on Joe's side. If maybe we could mute when we're not speaking. I don't know if that's possible. I don't know how to do that on here. I guess down at the bottom. Mm-hmm. But there's quite a bit of feedback. Great. Yeah, perfect. So thank you, Geoff and Joe, for giving a great overview of how AI and big data can impact healthcare. That was really great. I enjoyed it as well. And Gillian, thank you for organizing. Before jumping into brain health, I did want to give a shout out. Today is a very auspicious day. My background's in aerospace engineering and neuroscience. So, I worked in the Center for Space Research all through my graduate work at MIT. And today is, in fact, at 4:30, unless it's been delayed. I haven't been able to go look at the site because I'm afraid of messing up the technology. SpaceX is launching 2 American astronauts to the space station. And that's the first time that we will have launched, that we're launching Americans from our soil in over 10 years. So it's a very exciting day. Maybe we can go back and forth at some point and figure out what time that is. Someone can look it up for me and tell me in the chat maybe if that's still on, because I'm very excited about that. Because my history with technology is such that I want to solve problems with technology. And I was inspired originally by things like robotics and telemedicine to enable humans to fly in space. And that was 25, 30 years ago. And then, I learned that this field was called biomedical engineering. The degree didn't exist when I was going through school, but I became a professor of biomedical engineering and then started my company. And to me, AI and big data are other examples of things like robotics and virtual reality and all of these cutting edge technologies that can help us solve problems and help us enable people to do things that we couldn't do before. So now focusing in on big data and AI and a very practical example. I want to try and make it really very tangible for people. And this is where brain health has come. So I just want to tell you a story, and just to make it real. So just think about every time you go to the doctor's office, they take your blood pressure, your temperature, your height, your weight. We obsessively track our body mass index from the time we're born, but do we have a brain vital? Do we actually measure our brain health from cradle to grave? No, we don't. And why is that? And a lot of that is really historical. It's not that we don't think that brain health is important. It really dates back to the history of cognitive testing. It really used to be that you had to go to a specialist, a neuropsychologist, someone like that, who would give you a whole slew of paper pencil tests that then they would, they would hand score, and all the things that Joe said he's trying to get away from, and then manually, look at the data and come up with a score for that person. So there was a lot of data, but it really became, it was used in a way that it didn't allow for much sensitivity or specificity. So it wasn't very sensitive to different conditions, and it also couldn't tell different conditions apart in a lot of ways. And when computers came, and then we started just digitizing these same tests. When we had things like smartphones, it's not like we learned a new way of doing cognitive testing. We just digitized these old tests. And so now we have a lot of data that is now computerized, so it's easier to give the test. So we start giving them to lots and lots of people. And I was brought to the situation to solve a problem for the military. We've done a lot of work with the military, and we were working with both the Medical Material Command at the Army and the Navy Bureau of Medicine, and they were now in a situation where they had deployed soldiers who were facing conditions that were having a lot of effect on brain health. Certainly combat fatigue and stress affects your brain health, but then even more serious conditions were emerging, like depression, PTSD, concussions through blast injuries. And the problem was they had a lot of data, but they were using it incorrectly. So what was happening is they were doing these big tests that I just described to you on every single soldier before they're deployed. So they now have these baseline scores from millions, well, maybe a couple million soldiers. And then by law, they're required, if a soldier's exposed to a blast injury, they have to get another one of these big tests. And it's compared to not only their baseline score, but this big database. So now you're comparing this person who just had a blast injury to and who's been deployed for quite some time, to their pre-score. And of course it's different because they've been deployed for 6 months. And so then they compare it to the bigger database. Well, within this database, you have tons, it's all active duty military who have all been exposed to different conditions. So it just was a disaster waiting to happen. And in fact, it was a disaster because they ignored the test. Soldiers were coming home. They were dying by suicide. And then investigations were happening because people were saying, but you had this test that said you were, that said you had some sort of head injury. Well, they didn't have a head injury necessarily. They had combat fatigue and stress. They had depression. They had PTSD. Nope. So that's an example of big data gone bad. So big data doesn't necessarily mean a good thing. Sort of just pull it back and say what we said is, you know what? Let's go for sensitivity. Let's use all the tools that we have now. Let's use, any mobile device. Let's collect lots of data on one person and very, very sensitively look at all those trials instead of collapsing this 45-minute test of thousands of trials into one number. Let's take those thousands of trials and let's use some machine learning, a component of artificial intelligence. Yeah. Let's use these algorithms to really understand that person. And let's very sensitively track those changes over time so that if there's a change, we can raise a red flag. Now, maybe it's not enough to diagnose, but it's enough to raise a red flag and get attention. So that's just a simple example of big data, AI in a very real world, tangible example, and why digital health has made big data and AI advances really possible, and why it can be used as a tool to really impact the way we do something as generic as cognitive testing.
Yeah, no, I think that that's fantastic. And I see that Susan Madonna in the event chat has also indicated that the StartX launch will be is scheduled for 4:33 Eastern time. So in about half an hour.
Thank you, Susan.
So Susan, way to go on Googling that as well. I realize that we have just a few more minutes of our time together here. And what I'd really like to do for this, for the last sort of 2 minutes or so, is I'd love to go around to each of the panelists and, bringing AI and big data back to coronavirus and what's happening now in the healthcare system and the changes in the healthcare system. I'd love to hear from each of you. What in terms of what's top of mind for you in terms of what will change coming out of the coronavirus, specifically from a technological innovation perspective. So, Geoff, why don't we start with you, and then we'll go over to Corey, and then end on Joe.
I think the remarkable thing about the coronavirus is the magnitude with which it has focused attention on the ability and the opportunity to use virtual health or remote healthcare as a way of delivering care, and the incredible need to enable care that does not require people to be in the same room, crowded room, waiting to see the doctor, which is clearly not good in the setting of a pandemic. And what's happening, of course, is people are now discovering the impact that can have, how much easier or convenient it is, and doctors are finally realizing and giving this care how much of what they do can actually be done through a high-resolution video connection. So I think that is an indelible change in how people now, both people have discovered that it works and doctors are discovering that they can use it and that it's effective. And so I think the biggest change is going to be the more seamless adoption and integration of virtual care services as we move back to a more normal way of delivering care, the integration of virtual care where it's appropriate and demonstrated to be useful. And then from a big data and AI perspective, the more care that's delivered on a digital platform, the more information about that care is captured in a digital format, which provides a feedback loop to the AI methods that allow us to incrementally improve how our AI works in the process of delivering real care.
Excellent. No, and I think I certainly would agree with that as well. Corey, what's the sort of one sentence headline here, and then we'll go to Joe. So top technological innovation coming out of coronavirus here.
Yeah, I mean, that's a tough one
like
because
Gillian
the
dropped off.
technological
Her video's not working. I don't.
Sorry, do you want me to talk?
Yeah, carry on, Corey. Yeah, just a minute.
Okay.
So, one-liner.
Right. Yeah. So I was just going to say that, building on the virtual care services, I think the idea that telehealth is more than just video conferencing and teleconferencing, that we really are now going to be able to use sensors and apps, medical apps that are FDA cleared, and now we'll be able to be reimbursed because of CMS changes. I mean, the CMS changes alone are going to enable these technological changes that really have been in existence, and there hasn't been a technical barrier. So I think this crisis has removed the barriers that were not technical.
Mm-hmm. And Joe, for you, I realize there are a few tech issues over here. What's the one line?
Yeah, I agree with both Corey and Geoff wholeheartedly. That this pandemic has really accelerated the adoption of virtual health from both the patient and the provider standpoint. What would have taken another 5 or 10 years, I think we've really advanced adoption so much faster than we could have ever expected. And with that, just like Geoff said, with more digital health, virtual health being given, the more data. So I don't think we're going to go back to the old way of doing healthcare. Being a developer of telehealth services for the last several years, for some providers are adopters and are late adopters, and this has kind of shifted that paradigm. So that's one thing that I is a shining light in all of the difficulties of the pandemic. And new technologies, emerging technologies, I think we'll see those develop faster as well, like blockchain, ledger technology to manage identity and to broker those trust relationships and exchanges of value and information on a blockchain network. I think will be exciting to see in the coming next year or two as well.
Excellent. Well, I realize that we're just a few minutes over here, so I really want to say thank you to everyone watching, and thank you to my fellow panelists here, Geoff, Corey, and Joe, for joining us for this conversation on big data and AI.